Heart disease is a really important issue for women because it is the #1 killer of women here in the United States. In fact, 90% of women have at least one risk factor for the development of cardiovascular disease. One of the things that I tell women all the time is if you really want to assess your cardiovascular risk, it's important to know your numbers. And when I say that, there's a couple key numbers I'd like women to pay attention to: your blood pressure, your cholesterol, your body mass index, and your fasting blood glucose. It's important for women to know their numbers because when we know those numbers is when we can actually assess a woman's risk for cardiovascular disease, and then we can do something about it. Blood pressure is a really important number for women to know because having uncontrolled high blood pressure is a setup for a lot of cardiovascular diseases, and that can include things like having a stroke, having heart attacks, or having heart failure. And it's really easy to check your blood pressure when you're at the grocery store or if you're at a pharmacy. Oftentimes those type of places have devices where you can check your blood pressure. Not every person is going to have the same blood pressure target. A lot of it depends on what other medical things you have going on, and so that's why it's important for women to get with their doctors so they can assess their individual risk and know what's their personal target for blood pressure. Having high cholesterol is not something you feel, and so that's why it's important to go and get that checked. When you get your cholesterol, there's going to be 4 numbers that you see. The first is your total cholesterol, and that number ideally should be less than 200. The second is your HDL. That's oftentimes referred to as your good cholesterol, and ideally you want that to be as high as possible, say something above 50. The third number that you're going to see is your LDL, and that number you want to get as low as possible, something like less than 100. And the last number that you'll see will be your triglycerides. This should be less than 150. The good news about having high cholesterol is that there's some great options for treatment. Sometimes diet and exercise alone are all that a person needs, but if that's not enough, there's a lot of options for medications that you can talk with your doctor about. There are 3 numbers that are often tied together, and those are body mass index, waist circumference, and weight. And the body mass index is a number that's calculated based on your height and weight. And in general, the higher the person's body mass index, the higher at risk they'll be for things like heart attacks, heart failure, stroke, and diabetes. And the last number that you want to be aware of is your fasting blood glucose. That's a number that we can check after you haven't eaten for about 8 hours and lets us know whether or not you're at risk for diabetes. And that number should be less than 100. The bottom line is that even though cardiovascular disease is the #1 killer of women, it doesn't have to be. We have a lot of control over these numbers, and the first step is to know your numbers.